thank you everyone for coming. If you've just come downstairs, thank you. Welcome to those that are joining for the afternoon. And this is always a good moment when we do something slightly different. We are incredibly grateful to Matthew and all the medical history team for letting us do this, and it's great that the cabinet has been relocated. And I'm going to hand over to Jordan and Margerate.
Yeah.
Welcome. One go.
Okay, so we'll unveil it.
Yeah.
Drum roll. Get my script. So over the past 4 weeks, we've been working with the museum service within the university, creating a display that we hope inspires everyone and gets you to think about haematology as a central support system, helping our specialties run smoothly. As a block, we both thoroughly enjoyed, and it's not really been explored in the local area, like exhibition-wise. We believed haematology was the topic that needed attention. So you can see we've picked quite a lot of objects. So we'll run through our ideas and what we were thinking at the time. So just the top shelf.
Yeah, so for the top shelf, this is just, so we call this display the life of blood. So essentially we're just kind of go from like how the blood began, like how it came to surface and how it progressed through time. So the top shelf, so we've got the microscope, some blood samples, and that's just kind of see how blood came and how they saw it in like a microscopic setting. We also have some pictures as well. We've got a picture of Professor Dan Capel, and he's quite well known in Dundee for blood transfusions. So we thought it was quite good to put him in there because obviously it's really close to home as well. We've also got some pictures of staff nurses in Ninewells Hospital, and that's going back in 1974, so also just showing that progression of haematology speciality. And we've also got some old historical equipment of how they used to measure blood pressure, and then we also have a digital blood pressure monitor, so it's like a comparison and what they used to use back in the olden days. We have a hemocytometer, sorry, I butchered that completely, and that was to prepare like blood cells and count them, so obviously going back to like the microscopic setting as well. And for our bottom display, we wanted to kind of show how haematology branches out to other specialities and how haematology started as like one specialty, but it also relates to a lot. Especially when a patient comes in, like the first thing you kind of check is kind of bloods and to see what's wrong with them. So we thought it was kind of cool to see how it branches in. So we kind of we have the eye of model eye, and that just shows how you can see the blood vessels and how that can also, if blood vessels were obstructed or if anything was to happen, any occlusion, you can see how that would affect the eye. We also have a dialysis equipment behind in the back, and that relates to kidneys as well. And we got some glucocheck, and that relates to endocrine, so in diabetes, testing your blood for blood sugar levels. And then we also have some safety needles and blood lancets to show how blood was drawn. So the blood lancets that was used in olden day, and that's a comparison to the safety needles now, which we use nowadays. And yeah, I think that's everything.
Yeah, very much. So there were many objects that piqued our interest individually.
Yeah.
So we'll describe a couple of them to you a wee bit more. So for myself, the eye model, I'm quite into ophthalmology, so and I found the eye is like the only organ where you can actually see blood vessels without actually cutting into anything. So it's almost like a window into your health and like how you're doing and that kind of stuff. And it just shows how important blood is, granting function to almost every cell, and like every major function in the body, like sight and smell, how you think, etc., etc. And as someone who's had glasses all their life, this model is pretty important to me. And then another object that I found pretty important was the picture of Professor Dan Capel at the back here. So it just shows Scotland's impact made within haematology, and I just thought that was pretty special. You know, he established the blood transfusion service in Dundee, and that spread all throughout the country. I thought it just quite special that something from Dundee has been used throughout, and so it's quite nice to think about. And also, like, I've donated blood quite a few times, so I guess that's another personal take on it. Means something to me, just giving to people this life-saving treatment. So those are my two objects.
Yeah, for me, I chose the bottles. I think we all know, like, when we go in to like get our blood checked, they all have these like random bottles, like you don't know what colour they are. So I thought it was quite cool because back in the olden days they used to use that tiny bottle. So compared to now, you can see there's a massive difference, and also the colours that determines what they want to test in the blood. So for pink, that's just for your full blood count. For your purple, that is for a cross match, and then your blue, that's for checking coagulation. So I think it's quite cool how they used colours to differentiate what they want to check. I also was really interested in the GlucoCheck. So that's what they used to use back in the old days to check your glucose, which if you compare it to now, it's quite small and quite digital. So I think it's really cool because it looks like a mini little calculator, and it also has instructions inside to how to use it and how to check for your blood. And then I was mentioning previously about your lancets and safety needles. So it's quite tiny, but if you're able to see the lancets, you can see there's no safety cap, and that also emphasises how patient safety and care has like expanded through time. Of course, like now we have safety caps, so that protects the patients and also ourselves when taking blood from patients. Thank you.
We've got our panel here that you can have a read through. I've added an audio walkthrough. Just if you want to have a listen, do so, but make sure I'm not here. It took me a while to do that, and I don't want to hear myself. So. And then we've also got a QR code for the blood transfusion service. So if you want to donate, please scan it, and you can book an appointment.
That's great.
Thank you. And what we're going to do is we'll give you a few minutes to have a look at it, and then we'll reconvene back in the other room. Okay? But thank you. Well done.